So vaccination is historically safe and effective way to prevent infection or disease and to save lives. Immunizations prevent 2 to 3 million deaths every year from diseases like diphtheria, tetanus, pertussis, influenza, and measles. So when we get vaccinated, we aren't just protecting ourselves, we're also protecting those around us. So think about some people who are seriously ill or immunocompromised. They're advised that they can't get a vaccine. So they depend on the rest of us to get vaccinated so that we can help reduce the spread of the disease. So right now we don't know enough about immunity after coronavirus infection or vaccination to say exactly what percentage of the population will need to get vaccinated to achieve herd immunity. With some diseases, it takes vaccinating about 60 to 70% of the population in order to achieve herd immunity. But then in some instances, there needs to be at least 95% of the population to be naturally exposed or to get the vaccine for herd immunity to occur. So we'll likely have a better understanding of this percentage rate after more people become vaccinated. So the best way to protect yourself is to do what you may have already been doing this year, covering your mouth with mouth and nose with a cloth face covering, minimum of 2 layers, but preferably 3 layers, or a non-surgical mask when around others. Avoid crowds and stay at least 6 feet apart from others. So universal face masking is now recommended not only by the WHO and the CDC, so meaning a cloth mask should be worn indoors and outdoors in crowded locations. And then the CDC also recommends washing your hands often with soap and water for at least 20 seconds, especially if you've been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not available, you can also use an alcohol-based hand sanitizer as long as it has at least 60% alcohol.